Right now, questions and concerns after Chicago health leaders reported 2 unrelated measles cases in 24 hours. These are the city's first cases in 5 years. So what do you need to know to keep your family safe? CBS 2's Sara Machi is live in the newsroom after talking to area doctors. Sara, what are they telling you?
Well, Erica, the biggest 2 takeaways here is that this virus is extremely contagious, but your best defense is full vaccination. They also add there's a risk for people with weakened immune systems like chemotherapy patients.
They said there wasn't 1 square inch of your body that didn't have a measles on it, rash.
Franciscan health pediatrician Dr. Richard Saragioli says he doesn't remember catching measles as a child, but he, like others born before 1957, are considered to have lifelong immunity from exposure. Now, he urges his patients to give their children the 2-dose MMR vaccine against measles, mumps, and rubella.
These are real diseases that deserve real attention.
I think there was a time where I would have been surprised to hear about a measles case popping up in the U.S., but unfortunately not so anymore.
Director of Infectious Diseases for Franciscan, Dr. Erica Kaufman-West, says measles is primarily transmitted through respiratory droplets in the air, with a common set of symptoms, including fevers higher than your typical flu or cold, white spots on the inside of the mouth.
And then the classic rash of measles, which starts sort of around the hairline, the back of the neck and behind the ears, and then travels in a downward fashion. Other symptoms include cough, inflamed nasal passages, or maybe a little bit of a runny nose, conjunctivitis or irritation and swelling of the eyelids.
The virus is highly contagious.
Very, very much more than like strep.
Affecting 9 out of 10 unvaccinated people who come in contact with it. The city of Chicago quarantining unvaccinated migrants at this Pilsen shelter after the most recent case. Experts say it is important that patients who do contract the virus stay in place and reach out to a healthcare provider for next steps.
What we don't want to happen is to have people just walk into an emergency department and just sit in the waiting room and potentially have a lot of other exposures.
A measles infection can lead to severe complications like pneumonia, swelling of the brain, even death. Kaufman-West says that she has watched other measles outbreaks around the country. When herd immunity stays above 95%, the odds of 1 case turning into 10 is extremely low. But they add that the likelihood switches when herd immunity drops below that 95% threshold. In the newsroom, Sara Machi, CBS 2 News.
Thank you, Sara.